Hello class, good day. My name is Christine Uyerhena, one of the nurse instructor of your related learning experience in NCM 101. How are you all? How was your holiday break? I hope and pray that in spite of the pandemic, you and your family was able to celebrate Christmas joyously. It's a new year, and I'd like to welcome you back and bring you back to reality as we discuss another important lesson, which is the vital signs. So I need you all to buckle up as the vital sign and taking of vital signs is a long topic, and this topic you'll need to do a return demonstration which will be graded by your respective clinical instructors. Vital signs include temperature, pulse, respiration, and blood pressure. So these are the expected learning outcomes. Number one, explain the principles and mechanics of thermoregulation. Number two, describe nursing measures that promote heat loss and heat conservation. Number three, discuss physiological changes associated with fever. And number four, identify when to measure vital signs. So what is vital signs? The most frequent and routine measurements obtained by healthcare providers are those of temperature, pulse, blood pressure, respiratory rate, and oxygen saturation. As indicators of health status, these measures indicate the effectiveness of circulatory, respiratory, neural, and endocrine body functions. Because of their importance, they are referred to as vital signs. Measurement of vital signs provide data to determine a patient's usual state of health, or what we call as baseline data. Assessment of vital signs provide data to identify the nursing diagnosis, implement planned intervention, and evaluate outcomes of care. An alteration in vital signs signals a change in physiological function and the need for medical or nursing intervention. Vital signs are a quick and efficient way of monitoring a patient's condition or identifying problems and evaluating his or her response in the intervention. When you learn the physiological variables influencing vital signs and recognize the relationship of their changes to one another and to other physical assessment findings, you can make precise determinations about a patient's health problems. Vital signs and other physiological measurements are the basis for the clinical decision-making and problem-solving. So the purposes of vital signs taking is number one, to determine the course of illness, which serves as a guide in meeting the need of the patient. Number two, to afford an opportunity to observe the general condition of the patient. And number three, to aid the physician in making his diagnosis and planning patient's care. These are just some of the special considerations when taking vital signs. So number one, before vital signs are taken, be sure that the patient has rested. Number two, remember that the frequency of taking the temperature, pulse, respiratory, and the blood pressure depends upon the condition of the patient and the policy of the agency or your hospital. Number three, inform the physician or head nurse and clinical instructor promptly for any significant change in the vital signs. And number four, explain the procedure to your patient so that he or she will feel at ease. Things you need to remember about vital signs taking. Number one is the objective data, as taking the vital signs is considered as your objective data. The accuracy of your vital signs taking. It should be taken in a thoughtful and scientific assessment. Monitoring, depending on your patient's status or your hospital's policy. Then you can monitor a patient whether it would be every 4 hours, every 30 minutes, every 15 minutes. Again, it depends with your patient's status and the hospital policy. Vital signs taking can vary or change, and nursing judgment is very important, especially when there's an alteration in your vital signs taking. Guidelines for measuring vital signs. Vital signs are a part of the assessment database. You include them in the complete physical assessment or obtain them individually to assess a patient's condition. Use the following guidelines to incorporate measurements of vital signs into the nursing practice. Number one, measuring vital signs is your responsibility. You may delegate measurement of vital signs in selected situations. However, it is your responsibility to review vital signs data, interpret their significance, and critically think through a decision about interventions. Number 2, assess equipment to ensure that it is working correctly and provides accurate findings. Number 3, select equipment on the basis of the patient's condition and characteristics. Example, do not use an adult-sized BP cuff for a child. Number 4, know the patient's usual range of vital signs. These values can differ from the acceptable range for that age or physical state. The patient's usual values serve as a baseline for comparison with later findings. Thus, you are able to detect a change in the condition over time. Number 5, know your patient's medical history, therapies, and prescribed medications. Some illnesses or treatments can cause predictable changes in vital signs. Some medications affect one or more vital signs. Number 6, control or minimize environmental factors that affect vital signs. For example, assessing a patient's temperature in a warm, humid room may yield a value that is not a true indicator of his or her condition. Number 7, use an organized and systematic approach when taking vital signs. Each procedure requires a step-by-step approach to ensure accuracy. Number 8, on the basis of the patient's condition, collaborate with healthcare providers to decide the frequency of vital signs assessment. In the hospital, healthcare providers order a minimum frequency of vital sign measurements for each patient. Following a surgery or treatment intervention, you measure vital signs more frequently to detect complications. Number 9, use vital sign measurement to determine indications for medication administration. For example, give certain cardiac drugs only within a range of pulse or BP values. Administer antipyretic when temperature is elevated outside of the acceptable range for the patient. Number 10, analyze the result of vital sign measurement on the basis of the patient's condition and past medical history. Number 11, verify and communicate significant changes in vital signs. Baseline measurements provide a starting point for identifying and accurately interpreting possible changes. When vital signs appear abnormal, have another nurse or healthcare provider repeat the measurement to verify readings. Lastly, instruct the patient or family caregiver in vital sign assessment and the significance of the findings. So when do we take vital signs? These are just some of the situations when we need to take vital signs. One is upon admission to the hospital, when there is a reported change in the status of the patient. Another would be according to the nursing or medical order, and before and after surgery, medication administration, other procedures, and other nursing interventions. So we will now talk about body temperature. This is just an example of the thermometer where there is a Fahrenheit and a Celsius. So there are two kinds of temperature. We have the core temperature. It is the temperature of the deep tissue of the body, such as the cranium, thorax, abdominal cavity, and the pelvic cavity. So the temperature remains relatively constant to about 37 degrees Celsius or 98 degrees Fahrenheit. Another kind of body temperature is the surface temperature. This is the temperature of the skin, the subcutaneous tissue, and fat. It rises and falls in response to the environment from 20 to 40 degrees Celsius or 68 to 104 degrees. For the body temperature to stay constant and within an acceptable range, various mechanisms maintain the relationship between heat production and heat loss. One of these mechanisms of thermoregulation is neural and vascular control. The hypothalamus, located between the cerebral hemispheres, controls body temperature the same way a thermostat works in the home. The hypothalamus senses minor changes in the body temperature. The anterior hypothalamus controls heat loss and the posterior controls heat production. When nerve cells in the anterior hypothalamus becomes heated beyond the set point, impulses are sent out to reduce body temperature. Mechanisms of heat loss include sweating, vasodilation or the widening of the blood vessels, and inhibition of heat production. The body redistributes blood to surface vessels to promote heat loss. If the posterior hypothalamus senses that the body temperature is lower than the set point, then the body initiates heat conservation mechanism or vasoconstriction, which is the narrowing of the blood vessels, reducing blood flow to the skin and extremities. The other mechanism of thermoregulation is heat production. Temperature regulation depends on a normal heat production processes. Heat produced by the body is a byproduct of metabolism, which is a chemical reaction in all body cells. Food is a primary fuel source for metabolism. Heat production occurs during rest, voluntary movements, involuntary shivering, and non-shivering thermogenesis. Basal metabolism accounts for the heat produced by the body at absolute rest. Voluntary movement such as muscular activity during exercise requires additional energy. Shivering is an involuntary body response to temperature difference in the body, and non-shivering thermogenesis occurs primarily in neonates because neonates cannot shiver. Another mechanism of thermogenesis is heat loss. Heat loss and heat production occur simultaneously. The structure of the skin and the exposure to the environment results to the normal heat loss through radiation, conduction, convection, and evaporation. So there are four processes of heat loss. So first we will talk about radiation. So radiation is the transfer of heat from the surface of one object to the surface of another without contact between the two objects, mostly in the form of infrared rays. Example, radiation accounts for 50% of the heat lost by a nude person standing in a room at a normal room temperature. Another is conduction. It is the transfer of heat from one object to another with direct contact. For example, when a body is immersed in cold water. Another, convection. It is the transfer of heat away by air movement. A fan promotes heat loss through convection. This rate of heat loss increases when moistened skin comes into contact with slightly moving air. So these are just a picture of convection, conduction, radiation. And the last would be evaporation. It is the heat transfer of heat energy when liquid is changed to a gas. The body continuously loses heat by evaporation. Approximately 600 to 900 ml a day evaporates from the skin and lungs, resulting in water and heat loss. By regulating perspiration or sweating, the body promotes additional evaporative heat loss. When body temperature rises, the anterior hypothalamus signals the sweat glands to release sweat through tiny ducts on the surface of the skin. Sweat evaporates, resulting in heat loss. During physical exercise, over 80% of the heat produced is lost by evaporation. Another mechanism of thermoregulation is skin and temperature regulation. The skin regulates temperature through insulation of the body, vasoconstriction, and the temperature sensation. The skin, subcutaneous tissue, and fat keep heat inside the body. People with more body fat have more natural insulation than slim and muscular people. In the human body, the internal organs produce heat. During exercise or increased sympathetic stimulation, the amount of heat produced is greater than the usual core temperature. Blood flows from the internal organs carrying heat to the body surface. The skin has many tiny blood vessels, especially the areas of the hands and feet and ears. Blood flow through these vascular areas of the skin varies from minimal flow to as much as 30% of the blood ejected from the heart. Heat transfers from the blood through vessel walls to the surface of the skin and is lost to the environment through heat loss mechanism. The core temperature of the body remains within safe limits. For example, infants are able to sense uncomfortable warm conditions but need help to change their environment. Older adults sometimes need to help to detect cold environments and minimize heat loss. Illnesses, a decreased level of consciousness, or impaired thought processes result in an inability to recognize the need to change behavior for temperature control. When temperatures become extremely hot or cold, health-promoting behaviors such as removing or adding clothing have a limited effect on controlling temperature. These are the factors affecting body temperature. Number one is age. In infants, they are greatly influenced by the temperature of their environment and must be protected from extreme changes. In children, they continue to be more variable than those of adults until puberty. The elderly, they are at risk for hypothermia or the temperature below 36 degrees Celsius for the following reasons: lack of central heating, loss of subcutaneous tissue, reduced thermoregulatory efficiency, inadequate diet, and lack of activity. So this is just a diagram to show the variations in normal body temperature by age. So as you can see that there are different average temperatures of a newborn and different in a 1-year-old, 3 years old, 5 years old, adult, and elderly. So another factor affecting body temperature is the diurnal variation or the circadian rhythm. Body temperature normally changes throughout the day as much as 1 degree Celsius between early morning and late afternoon. The highest point of the body temperature is between 8 p.m. and midnight, and the lowest point of the body temperature is between 4 a.m. to 6 a.m. Another factor would be exercise. Hard work or strenuous activity can increase body temperature as high as 38.3 degrees Celsius to 40 degrees Celsius if measured rectally. On average, an individual's core temperature varies from 36.5 to 37.5 degrees Celsius over the course of the day. Their temperature doesn't remain constant, however, it fluctuates according to your circadian rhythm. Generally, this means your body temperature is at its lowest a few hours before you wake and its highest an hour or two before bed. So another factor that affects body temperature would be our hormones. Women usually experience more hormone fluctuations than men. Ovulation time increases in progesterone level by about zero point 0.3 degrees Celsius to zero point 0.6 degrees Celsius. Another factor would be stress. Stimulation of the sympathetic nervous system can increase the production of epinephrine and norepinephrine, causing increase in metabolic activity and heat production. Example would be highly anxious clients before surgery that could cause an increase in temperature. Another factor would be environment. Extremes in environment temperatures can affect a person's temperature regulatory system. Example, if a person has been out in an extremely cold weather without suitable clothing. So now we will be talking about alterations in body temperature. So changes in body temperature outside the usual range related to excessive heat production, excessive heat loss, minimal heat production, minimal heat loss, or any combination of these alterations. So pyrexia, or fever in layman's terms, is a body temperature above the usual range. So it's called pyrexia or hyperthermia. A client with fever is said to be febrile, and without fever is afebrile. A very high fever, 41 degrees Celsius or above, is called hyperpyrexia. So heat stroke. Heat depresses hypothalamic function. Prolonged exposure to the sun or high environmental temperature overwhelms the heat loss mechanism of the body. This condition causes heat stroke, defined as a body temperature of 40 degrees Celsius or more. Heat exhaustion occurs when the profuse diaphoresis results in excess water and electrolyte loss. Hypothermia, which we'll be talking more about later, is a heat loss during prolonged exposure to cold, overwhelms the ability of the body to produce heat. So who are the clients at risk for hyperthermia, or those patients with a temperature of 40 degrees Celsius or above? So these people who have infection, debilitated patients who are vulnerable to infection, people with disease processes of the central nervous system that may impair thermoregulation, people who have head trauma causing increased intracranial pressure, and neonates who have ineffective thermoregulation. So we now delve more about fever. Fever occurs because heat loss mechanisms are unable to keep pace with the excessive heat production, resulting in an abnormal rise in body temperature. A true fever results from an alteration in the hypothalamic set point. Pyrogens, such as bacteria and viruses, elevate body temperature. They act as antigen-triggering immune system responses. The hypothalamus reacts to raise the set point, and the body responds by producing and conserving heat. Several hours pass before the body temperature reaches a new set point. During this period, a person experiences chills, shivers, and feels cold. Even though the body temperature is rising, the chill phase resolves when the new set point, a higher temperature, is achieved. During the next phase, the plateau, the chill subsides and the person feels warm and dry. If the new set point is overshot or the pyrogens are removed, example by destruction of bacteria by antibiotics, the third phase of febrile episode occurs. The hypothalamus set points drop, initiating heat loss response. Diaphoresis assists in evaporative heat loss. When the fever breaks, the patients become febrile. During a fever, cellular metabolism increases and oxygen consumption rises. Body metabolism increases 10% for every degree Celsius of temperature elevation. Heart and respiratory rate increases to meet the metabolic needs of the body for nutrients. Fever is an important defense mechanism. Mild temperature elevation as high as 39 degrees Celsius enhances the immune system of the body. Fever also fights viral infections by stimulating interferon, the natural virus-fighting substance of the body. The duration and degree of fever depend on the strength of the pyrogen and the ability of the individual to respond. So the term FUO, or fever of unknown origin, refers to fever with an undetermined cause. So the four common types of fever are intermittent, remittent, relapsing, and constant. During an intermittent fever, the body temperature alternates at regular intervals between periods of fever and periods of normal or subnormal temperatures. During a remittent fever, a wide range of temperature fluctuations, more than 2 degrees Celsius, occurs over the 24-hour period, all of which are above normal. In a relapsing fever, short febrile periods of a few days are interspersed with the periods of 1 or 2 days of normal temperature. During a constant fever, the body temperature fluctuates minimally but always remains above normal. A temperature that rises to fever level rapidly following a normal temperature and then results to normal within a few hours is called a fever spike. So these are the nursing interventions for clients with fever. Number one, we need to monitor the vital signs. We need to assess the skin color and temperature of our client, monitor the white blood cell count, hematocrit value, and other pertinent laboratory reports for indicators of infections or dehydration. We need to remove excess blankets when the client feels warm, but provide extra warmth when the client feels chilled. We need to provide adequate nutrition and fluids. For example, 2.5 to 3 liters per day for patients with normal cardiac and renal function to meet the increased metabolic demands and prevent dehydration. We need to measure the intake and output to see if there's any dehydration with our client. Reduce the physical activity to limit heat production, especially during the flush stage. Administer antipyretic or the drugs that reduce the level of fever as ordered by our doctors. Provide oral hygiene to keep the mucous membrane moist. We need to provide a tepid sponge bath to increase the heat loss through conduction. Provide dry clothing and bed linens. So now we will talk more about hypothermia. Hypothermia is a core body temperature below the lower limit of normal. Death usually occurs when the temperature falls below 34 degrees Celsius or 93.2 degrees Fahrenheit. With severe hypothermia, sleepiness and even coma are likely to develop, which depresses the activity of heat control mechanism further to prevent shivering. So who are the clients at risk for hypothermia? So these are people who participate in cold weather sports, infants and children whose thermoregulatory systems are immature, elderly people who have insufficient food, clothing, or fuel, people who have neurologic deficits are unable to identify or respond to cold, alcoholics who have extreme heat loss secondary to vasodilation, and street people who lack adequate clothing and shelter. So what are the three physiologic mechanisms of hypothermia? So number one is excessive heat loss. Number two is inadequate heat production to counteract the heat loss. And number three, impaired hypothalamic regulation. Hypothermia may be accidental hypothermia. It can occur as a result of exposure to a cold environment below 16 degrees Celsius or from immersion of cold water. For example, people falling off in an icy cold lake. Another hypothermia can be induced hypothermia. It is a deliberate lowering of the body temperature to decrease the need for oxygen by the body tissues. Involve the whole body or the body part. It is sometimes indicated prior to surgery, example, cardiac and brain surgery. So what are the clinical signs of hypothermia? So there's a decreased body temperature, severe shivering initially, feelings of cold and chills, pale, cool, waxy skin, hypotension, decreased urinary output, lack of muscle coordination, disorientation, and drowsiness progressing to coma. So how do we manage hypothermia? It involves removing the client from the cold and rewarming the client's body. For clients with mild hypothermia, the body is rewarmed by applying blankets. For severe hypothermia, a hyperthermia blanket, an electronically controlled blanket that provides specified temperature, is applied and warm intravenous fluids are given. Replace wet clothing, which increases heat loss because of the high conductivity of water, should be replaced by dry. So now we will talk about thermometers. A thermometer is an instrument used to measure a temperature. So there are two types of thermometers available for measuring body temperature: electronic and disposable. The mercury in glass thermometer, once a standard device, has been eliminated in some healthcare facilities because of the environmental hazards of mercury. This is just to show you the mercury in glass thermometers, as there are still a lot of hospitals here in the Philippines that uses these kind of thermometers. So there are three kinds of mercury in glass. We have the axillary thermometer, may have long and slender tips, the oral for pear-shaped tip, and the rectal short rounded tip. So as you can see in this picture, the rectal mercury thermometer, it has a short rounded tip, and the oral has a pear-shaped tip. So now, going back to electronic thermometers, the electronic thermometer consists of a rechargeable battery-powered display unit, a thin wire cord, and a temperature processing probe covered by a disposable probe cover. So electronic thermometer provides two modes of operation, a 4-second predictive mode and a 3-minute standard temperature. So we will try to cover all the available electronic thermometers in the market or used in different hospitals. So this is one thermometer. As you can see, there's, I don't know if you can see it properly, but there's a covering in the probe, and this probe, you put it under the tongue to check the temperature of the patient. And this is the one that we widely use, which is the digital thermometer, where you just press this little button here and wait for a few seconds or minutes, and then it will give you the temperature that you need. Another digital or electronic thermometer are the infrared thermometers. So the digital infrared ear thermometer are used to both babies and adults. Infrared thermometer, they measure temperature quickly and without contact. A new addition to our line of sensors is an infrared thermometer. The sensor works by measuring the infrared radiation emitted by objects. For most objects, you simply point the sensor at the object and read its temperature. Our infrared thermometer features automatic backlighting, simple on and off operation, and laser sighting. So you just need to check with the instructions manual on how to use the infrared thermometer, as there's a lot of infrared thermometers available in the market, especially now with the COVID pandemic. So if you're using a digital thermometer, simply press the button to turn it on. So for oral, place it under the tongue. Wait until the digital thermometer beeps for approximately 5 minutes for a manual thermometer. Remember not to take an oral temperature right after eating or drinking something because it will alter the results. Axillary, or your underarm, place under the arm with the tip of the deepest crease. Wait until the digital thermometer beeps or approximately 5 minutes for a manual thermometer or the mercury in glass thermometer. Rectal, you need to use lubricant such as petroleum jelly and place tip in the anal opening. You don't need to insert all the thermometer inside, just the tip. Wait until the digital thermometer beeps or for approximately 5 minutes for a manual thermometer or the mercury thermometer. This method should be used for infants or those whose temperature cannot be taken any other way. So we will talk about the tympanic temperature, the one where you put it in the ear. So you need to pull top of earlobe up and back for an adult and down then back for a child. You need to place a tip covered with a probe cover in ear canal opening. Press button until it beeps. Be sure you are pointing the probe into the ear canal opening and not on the wall of the ear because this can alter the results. For the temporal, press button down and sweep probe across forehead. This is a fairly new technology but seems to be relatively accurate and very quick and easy to use. And because of this pandemic, again, we've been using the temporal infrared thermometer where whenever we go, when we go to the malls or other establishments, our temperature are checked using the infrared thermometer. Another kind of thermometer is the chemical dot thermometers. These are single-use, thin strips of plastic with temperature sensor at one end. The sensor consists of matrix of chemically impregnated dots that change color at different temperatures. So what are the advantages and disadvantages of four sites of body temperature measurement? So when we talk about oral, the advantage is it's very accessible and convenient. But the disadvantages are glass thermometers can break if beaten, inaccurate if client has just ingested a hot or cold food or fluid or have just smoked, could injure the mouth following oral surgery. For rectal, the advantages are it's a reliable measurement, and the disadvantages are inconvenient and more unpleasant for clients, difficult for clients who cannot turn to the side because we need the client to turn to the side, could injure the rectum following rectal surgery. Presence of stool may interfere with thermometer placement. If the stool is soft, may be embedded in stool rather than against the wall of the rectum. For axillary, so the advantage is it's safe and non-invasive, but the disadvantage is the thermometer must be placed in a long time to obtain an accurate measurement. For tympanic, the advantages are it's readily accessible, reflects the core temperature, it's very fast. The disadvantages can be uncomfortable and involves risk of injuring the membranes if the probe is inserted too far. Repeated measurements may vary. Right and left measurements can differ. And the presence of cerumen in the ear can affect them. So this is just a diagram of the temperature conversion charts. So if we talk about the 37 degrees Celsius temperature of your patient, so it is in Fahrenheit, it is 98.6. So how do we convert it? So how to compute or convert Celsius to Fahrenheit or Fahrenheit to Celsius? So first we talk about Fahrenheit to Celsius. So the formula is Celsius is equivalent to Fahrenheit temperature minus 32 times 5 over 9. So for example, 100 degree Fahrenheit Celsius, we need to convert it to Celsius. Did I read it right? For example, a Fahrenheit of 100 degrees Fahrenheit, we need to convert it to Celsius. So the solution is, for the Celsius, 100 is equivalent to 100 minus 32 times 5 over 9, so 68 times 5 over 9. So 100 degree Fahrenheit temperature in Celsius is 37.7 degrees Celsius. So Celsius to Fahrenheit. So the formula is the Fahrenheit is equivalent to Celsius temperature times 9 over 5 plus 32. So for example, 40 degrees Celsius, we need to convert it to Fahrenheit. The solution is 40 times 9 divided by 5, so that's 72. Then we add 32. So as 40 degrees Celsius is 104 degrees Fahrenheit. So that is the end of the concept, and I hope you learned a lot about vital signs and about the body temperature. Thank you and God bless.